This might be a huge contributor to dry eye or eye irritation that a lot of doctors are either brushing off or completely misdiagnose. This is called conjunctivochalasis. So we're going to go over exactly what this is, how you get it, and ultimately how you can get rid of this. Going over the anatomy, the eyeball and inner layer of the eyelid is aligned with this clear tissue called conjunctiva. And this might sound familiar if you get a conjunctivitis or a pink eye. It's usually the inflammation of that layer, the conjunctiva. Now normally this tissue is nice and clear and smooth and slippery. It's nice and coated, and so it doesn't have any really big friction between the eyelid and the eyeball. But what can happen is that tissue can either become inflamed or develop kind of a loose, redundant tissue called conjunctival folds. And when it does this, this extra loose, redundant tissue takes up the space between the eyelid and the eyeball where your tears usually are. And this is actually very common to see in patients. A lot of times we see it in the inferior lower portion, lower eyelid area. It can also happen under the top eyelid as well, just not as common. But because this is considered a senile change or a change that can naturally happen as we age, sometimes it gets overlooked as being one of the significant contributors to ocular discomfort or dry eyes. But depending on the severity, it can range from either people not even feeling it, being completely asymptomatic, to some people coming in and saying, I feel like I have a constant eyelash in my eye or something rubbing in my eye, because a lot of that redundant tissue is being rubbed and moved by the eyelid. Especially every time they blink, it can bump into that tissue and it can drive some people bonkers. Now there's a few ways that this specifically messes with dry eyes. Now normally the structure of the eyelid and the eyeball creates what's called a tear meniscus or tear lake. This is where your natural tears kind of have a reservoir. You can kind of think of it as a lake or a pool of tears that the eye can draw from to kind of keep the eye coated with fresh tears. In fact, this is something that we can look for in a dry eye evaluation, kind of measure the tear lake volume or how much of a tear meniscus layer a patient might have. And so when you get this redundant tissue, the conjunctivochalasis, that takes up the room, it's kind of like you are filling up the lake with dirt, rocks, and so there's not any room for there to be a lake or a pond or water to fill in those areas. And number two, along the same lines, because it's supposed to be nice and smooth, hardly any friction, the eyelids are designed every time you blink to recoat the eyes with a fresh set of tears. When you have that redundant tissue, it tends to mess up your blink. It doesn't have that nice smooth surface, so the tears get distributed unevenly. They get pushed around. Maybe some areas of the eye don't get tears that coat the surface. And so a lot of times that patient will feel like their eyes water all the time or just gets really irritated in the corner of the eyes. Now the exact cause, the exact pathogenesis to this is not really fully known or fully understood. Now, like I said, it's definitely linked with the natural aging process over time. A lot of the structure and tissue does get loose inside the eye, pretty much everywhere in the body. And so that structure does cause that little bit of change in redundant tissue in there. Also, over time, people get exposed to more oxidative stress, and it leaves behind these inflammatory cytokines or inflammation cells that cause more inflammation to that tissue or thickening of the tissue. Now, like I said, the main risk factors for getting this, the number one is age-related, just kind of a natural change to the eye. But here's a list of other possible risk factors that might cause you to get this even earlier on in age. As you can see, just kind of like the mechanical friction from blinking, how your eyelids are set. If you do suffer from a lot of inflammation, ocular surface inflammation with meibomian gland dysfunction, or even if you are someone that has a delayed tear clearance, maybe you have a little bit smaller of a puncta where the drain is for the tears, and a lot of your tears do kind of build up over time, and a lot of those cytokines, inflammatory cells, kind of build up onto the surface of the tissue, causing that inflammation. Now, the thing that surprised me when I started looking into some studies, the prevalence rate, even in the lower ages, were higher, way higher than I initially thought. If you look at this chart, this was from one study, they found that by the time of age 41, it was 90%. In fact, in their 20s, 60% of the people had conjunctivochalasis. Now, this can range from mild to severe, but way more prevalent in younger ages than I initially thought. Other studies showed kind of similar things. Overall, I'd say the average, if you were 40 and above, about 50%, 1 in 2 people had conjunctivochalasis in some form or another. It's found that it is more prevalent in women, and like I said, usually you find it on the inferior or lower eyelid. Most commonly is temporal or outer corner of the eye. That's usually where I see it in patients. But if you are unlucky and you get it in the nasal corner, the inner corner of the eyelid, that's where people usually have the worst symptoms. Now, this might be something that you can go check out right now in the mirror. It can sometimes be difficult to see just with your naked eye. It's a lot easier, obviously, to see it under a microscope. But if you wanted to go look at it, if you look at the mirror, you might see some redness or irritation in the corner. But if you really want to check it out, take your phone, have someone take a picture or zoom in on your eye. Don't bring the phone really close to your eye because that can mess with the focus. Bring the phone out and use the zoom lens, maybe zoom 3, and have them zoom in right on the corners of the eyes to see if you can see if any of that redundant tissue. Okay, so now let's get into the treatment, the meat and potatoes of why you probably continued watching this video. Usually the first line of therapy is to use preservative-free artificial tears. I know that's an answer that not a lot of people want to hear because they're probably sick of eye drops, but using frequent use of artificial tears multiple times during the day can limit the amount of friction from the eyelid and the eyeball. It can calm inflammation down and overall help the surface of the eye if there is tear disruption caused by the redundant tissue. Here's a few artificial tears that can be good ones if you haven't tried them. Also, I'll put a list in the description if you want to check those out as well. Another prescription treatment that you can get from your doctor is anti-inflammatory eye drops, steroid eye drops to decrease the inflammation. Now, with these cases, even with the prescription eye drops, you're trying to manage the symptoms, trying to make it not get any worse, decrease the inflammation, but there is a good chance that it might come back. It's not really curing the condition. Another one is considered an off-label treatment, so this is something you definitely want to talk to your eye doctor about. But there are a lot of people, a lot of doctors out there that will tell their patients to use Lumify. Again, off-label, but Lumify is an over-the-counter eye drop mainly for redness. It's designed mainly to reduce vessel congestion, a lot of dilated, beefy blood vessels, and that's why it's considered a kind of get the redness out type of drop. But a lot of doctors have found that it can tighten up the conjunctiva a little bit, enough to maybe reduce symptoms, maybe in mild, maybe moderate conjunctivochalasis. Now getting into the procedures or surgeries that can treat conjunctivochalasis, probably the one that's been more common and popular over many years is conjunctival cautery, where they can cauterize the tissue to remove that extra redundant tissue. When you look at the pictures and see the procedure, it seems kind of barbaric, but the outcomes actually have been really good. Another few options are using laser-based treatments. There's an argon laser, can work really well. One that has been shown to be really effective is a plasma-based laser that can really shrink the tissue. And then also a near-infrared wavelength type of laser treatment that has worked really well, can reduce the tissue and has very minimal bleeding, and recovery time is better with this as well. Another option is using high-frequency radio waves. So there's a high-frequency radio wave electrosurgery that they can use to reduce that tissue as well. In fact, most patients that have this usually have a resolution of conjunctivochalasis within 1 month of the procedure. And it's also shown to be very effective in people that have mild, moderate, maybe younger age conjunctivochalasis as well. Now, another popular surgical procedure is a conjunctival excision, where they surgically remove that extra tissue. And now an option that is becoming popular is to suture an amniotic membrane over that excision point. The amniotic membrane supplies the tissue with rehealing factors, natural factors, makes the healing process a lot better, more natural, more effective, and faster. So if this is something that you think that you might have, you're interested in it, definitely talk to your eye doctor about it, see if they can kind of look for any signs of conjunctivochalasis, because like I said, definitely a common one that gets overlooked or brushed off or misdiagnosed. And I think we as doctors need to be better just to highlight certain things that might be there in patients' eyes. If you have any questions, leave them in the comments. I'll try and answer the best I can, but definitely check out the description. I'll put links to different eye drops and links to different research articles so you can kind of learn more about this and maybe check out some different pictures of what this might look like. Hope this helped. Stay focused.